I think it's a good segue when you speak about who's involved and who should be involved in this fight, this long marathon of the fight for single payer, because I started with S2 back in the 70s, actually, and worked for Kennedy during his campaign directly as labor's representative there. So that's a bit of background, but talking all the way up to now, we've made a minimal effort within the labor movement to bring everything together, and I think that's been shameful. And so this year, and I'm asked to speak about this, there's been a renewed effort to bring more concentration, more collectivity to the labor effort. But I should say that there was plenty of labor activity going on, and in fact, some very inspired activity. We all know how, for many years, the California nurses were like the dynamic lost battalion, fighting all across the country. Which, and this is also to be respectful of those of you who belong to your own version of lost battalions for single payer all across the country as well. And then, of course, there's the work that Kay and Walter Tillow have done with the unions for single payer in developing the communication, the contacts, and building a base for endorsements within the labor movement, and providing an inventory so that this year, when it became even more needy to move the labor movement into a better place, we had such access to information about who was where. So in January, as already been mentioned, I think Lou mentioned it among others, we had a meeting here in St. Louis. 150 leaders and activists from the labor movement came, founded something which was not intended to be an organization, but exactly what it called itself, a campaign to knit and integrate the effort of those, the coalition already of the willing to bend the or not so willing toward that arc of justice. We have over time, thanks to the great work of Mark Dutzik and a steering committee of some 35 persons, which I'm pleased to be a part of as well, considerably widened the involvement of the labor movement. And I should halt for a second and say, it's only my view, but I trust some others will share it. In a situation where social mobilization requires more than just good intentions, without the labor movement in this country and in most other countries and its resources, being brought together as it should always be brought together for social justice, you have a very, very hard time achieving the finish line. And so it's been part of our mission not only to be actively involved and provide some collective companionship to all of you, but to be an integrated part of the entire effort as a whole, but to honor that tradition that the labor movement is supposed to be the major mediating force for the working class. And if this working class in this country doesn't need what all working classes in other countries already have in the area of healthcare, so it is an important juncture here this year that the labor movement has, at its most recent AFL-CIO convention, adopted a resolution which says, I think you have to bear with it a little bit, did not say that they would stop the action in Washington in its tracks by calling up President Obama and Mr. Congress and saying, we're off the train, we're now for single payer. But what it did say is beyond the current downhill desperation that's going on in Washington right now, it will be the policy of the AFL-CIO from that point forward to be the advocate for single payer, and I think that brings a lot more resources and respectability at some level to working people under the tent. There would have been a couple of other things that I might note, and that is that we would intend in our labor campaign, which has been built by these many activists, as I point out, all around the country, like Ray, of course, like Michael and Roseanne and the California nurses, as well as such an inspiration. But we are graduating to an everywhere situation, and the resolution by the AFL-CIO allows for, I think, a lot more of that, and we'll be moving forward into the next year. I, like most of you in the room, find nothing to be comforted about by any of the activities that are going on, and I see nothing but a further downhill slide with the balance of the legislative activities. I want to say that one quick thing I would include here. This myth that people like what they have. I heard someone else refer to that earlier. You know, that's just when we talk about labor contracts, and that's of course what they're predicating a lot of that myth around, that people like that. We have been giving back the wages that we traded over the years. I know directly, Claire knows, Lou knows, all of us at the UAW, we used to have not the Cadillac, we had the Lamborghini of healthcare programs, which now, more and more, every day, workers retired and active are being forced to pay more and more for just to maintain at this level. So it isn't, that myth is a myth, and we should stop letting the administration or anybody else get away with that whenever we hear it. That people like what they've already got. Only if they've been bamboozled into thinking they should like what they've already got, because it's been being taken away and steadfastly eroded over the years. I want to close by saying, as we should all know, healthcare is but one of the fronts that we have to be concerned about in the struggle for social justice. But I will say, when we whip this healthcare problem and we bring it into the right place where it should be, and we take the corporate community and its greed out of the picture, it will be such a major setback for them that it will help open the door for many of the other struggles as well. And we must persevere in that continuing struggle. Thanks.